She is author, producer, motivational speaker, business, and life coach, Miss Rogina Smith. It's our Money Matters Show with Rogina Smith, right here on Rejoice 1023.
Good evening. Welcome to Our Money Matters, the show that will motivate, educate, and equip you with financial empowerment to live your best life now. I am your host, Rogina Smith, President and CEO of Positive Image Consulting out of Atlanta, Georgia. Hello, JV. I am back. It is so good seeing you. I miss you.
I missed you more. That whole week is, whew, I'm glad you're back.
It's good to be back. And ladies and gentlemen, as you know, I have the best engineer on this side of the river, JV. We're going to get started this evening. I am excited. I have a guest, and you need to call your cousins, your friends, your neighbors, because you need to tune into this. You know, our show is about power, knowledge, about your money. But there's some things that, again, we don't like to talk about, things that we're not doing right with our bodies that have something to do with our money. So, my guest this evening is Dr. Janet Seabrook. Welcome, welcome, welcome.
Thank you so much. Thank you for having me.
It is my pleasure and my listeners' pleasure to have you with us this evening. Now, we're going to dive right into it. We're going to talk about some things that, as we were sharing earlier, that we're just so bombarded with doctor bills, and the cost of our medication is going up, and we're going to the doctor more often. We're living longer, but we have so many issues. And um, help me out.
Okay, so let's put it in a little perspective. And I'm so glad, thank you for having me here to be able to help people make the connection. People typically don't make the connection financially with medical until they're in a situation that then causes them to have to make life altering financial decisions that can put them sometimes in a very precarious situation. So again, I have to say thank you because most people don't understand the financial implications when people don't take care of themselves in a positive, preventive manner, so that later on, when things come down the line, such as hypertension and diabetes, if those things run in your family or high cholesterol, if you have not been in front of those things trying to take care of them, what can happen is that they can financially burden you and your family and cause a lot of financial distress.
I know that personally. I know that personally. Having a situation where it just strapped me financially. I had an emergency surgery in between leaving Indiana and moving on to my residence in New Jersey as I, got married and everything. So I thought I was just okay for the month. I'm going to be married in a month, so I don't have to worry about anything. Within that month, my appendix burst. So I had a doctor bill that was just unbelievable. And so, with parents from old school, you have to pay that bill. But I notice now a lot of people are getting in bad debt because of hospital bills, things that's on their credit report, doctor bills that they don't pay. So, how can we avoid this?
So we need to be proactive about our health care and financial decisions that we make for ourselves and for our family. So let's back up a little bit and let's talk about some preventive maintenance. People take their cars in for oil changes to get the tires when the tires need to be changed and rotated. We do all of those things to make sure that our vehicle is reliable so we don't have expensive repairs on a vehicle that we have not been taking care of. So let's just think about our bodies as the same type of vehicle that we have to maintain and be able to take care of, so those expensive things don't pop up at the most inopportune times. And someone may be out there listening and say, well, how can you prepare for something like a fall or an accident that may happen to you? If you've taken care of yourself, but then also thought about forward thinking things such as health insurance, life insurance, health savings account, those type of things can come in and help when you are, quote unquote, short term disabled and unable to work. So there are a myriad of things out there for people to be able to take advantage of, to be able to better put together a plan of action, so to speak, or leaving instructions for family members in case something catastrophic does happen to you or unexpected.
Now let's back up, because one of the things a lot of people say, and I know you've heard this, I can't afford health coverage right now, or you know what, I'm good. I'm healthy. I'm going to work every day. I don't need health benefits. I'd rather take the money instead of the health benefits with my employee. What do you say to my listeners about that?
Well, I would say, and some people may not like it, I don't think that that's a smart decision. There are affordable plans available for people who need health coverage, but then there are also places such as our health center, Community HealthNet, that are able to take care of people who don't have health insurance. We provide medical coverage, behavioral health services, pediatric, OB services to patients regardless of their ability to pay. We're not going to turn anyone away, and we're going to provide the services that they need. However, we also have trained and certified outreach and enrollment staff who are able to sit down with you and look over the various healthcare plans that are available in our state to help find some things that may be affordable for you and your family. If we're able to help you find some type of coverage, then that's all the better for you and your family. If you aren't able to afford coverage, again, we're not going to turn you away. We're going to go ahead and provide those services, those much needed health services to you and to your family.
So let's back up, like your favorite words you like to say. So you're saying that Susie, who's a millionaire, and Bobby, who's strapping for cash, they can walk in your door and get the same service? Tell my listeners where they can come to again. Give me the address. Now, I know you have 5 locations. Do you have a website? Can you give my listeners the website, the telephone number to where they can come and receive your services or get some type of consultation? Listeners, if you have any questions, I'm going to open the mic up. This is very, very important. Indiana, 219-933-9922. In Chicago, 773-288-9922. This is some good information, some things that you need to know. One thing I want you to share with the listeners, there's some enrollment time that's coming up. They need to know the dates, and let's just bombard them with the dates and times and the places of where they can go to sign up for health care.
Okay, so I'm going to go slow so everyone who has a pen or pencil in their hand will be able to write this information down. Answer to your question, yes, we do have a website. It's chn-indiana.org. chn-indiana.org. That is our website. The website is very informative. It will give people all of the information about our 5 locations in Northwest Indiana. But I am willing to give you the information. Our phone number, which is a general number, 219-880-1190. That's our main number. and you will speak with an operator, and depending on what your request is, you'll be forwarded to the location that you need to speak with one of the providers or either one of their assistants.
Listeners, did you get that? Please, again, you may not need it, but I guarantee someone in your circle need this information. Financial empowerment. We all can help one another in maintaining a financial status. Someone you know need this information. Take it down. Get this information. We're going to repeat it a couple of more times in this broadcast series. Get this information over to our family and friends. Help one another out. So, doctor, tell me, one of the things I wanted to share with you, I remember a time in my life where I was changing insurance packages, and there was a situation where I didn't need prenatal care. And as I was idolizing, going down, itemizing everything that they wanted to offer to me, I was like, I don't need this. I'm over the years of having a baby. And so taking out that little piece, oh my God, saved me over $1,000 that year. So people don't understand that they can look at their business plan, explain to people how they need to look at their benefit package and some things that they may not need. If you 55, 60 years old, you don't need that prenatal care. I don't think so. Explain it to the listeners.
So that's a great question, and thank you for asking. What our certified enrollment specialists are able to do is exactly what you did on your own, is to go over the packages and explain the benefits of each one of the different types of insurances that the companies offer that best fits the individual or their families. And so with those certified counselors, they're able to really kind of get down in the weeds and find out what the needs of the individual or the family are, so they won't be paying unnecessarily for benefits that they don't need. I do also want to make sure and mention that we have bilingual staff available at our location, so we're able to communicate with our patients in English and in Spanish if that's needed. We also have a translation line where we're able to get other languages for our providers to be able to communicate with their patients.
So it is no need for people not to have or come and talk to someone on your staff about the services that you render.
No excuses at all.
Well, listeners, I was just passed a note by Mr. Ward, which is the PR person for Dr. Janice Seabrook. And he want me to announce again that I am talking to Dr. Janice Seabrook, CEO of Community HealthNet Health Centers. She is with us this evening. Listeners, this is some good information. I mean, you cannot avoid good health or bad health. You're going to have one or the other. What are some of the myths that people come up to you and say that you can just start pulling your hair out and say, that's not true. That's not true. Give my listeners some information in reference to that. They need to stop thinking or talking that.
Well, typically in the African American community, what is really troublesome and bothersome is hypertension. And we've gotten used to the headaches and the blurred vision, and they really don't bother us. And we get up in the morning and we look in the mirror and we look okay, we look good, so we think that everything is good. And we don't understand that those two numbers that the nurse or the doctor gets when you check your blood pressure are life and death numbers. And we just don't take them seriously because we feel okay with those high numbers, and we don't believe that we need to be on any type of medication. And that's why we have such a high incidence of stroke in our community because we really don't do the things that we need to do in taking care of ourselves and reducing our blood pressure. We like our salt, we like our fried foods, and there are some things that we just refuse to give up. And you have some patients that absolutely do not believe that they have hypertension until you have to tell them that their kidneys are shot and you need to put them on dialysis.
Wow. 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 One of the things that I hear and tell me um, that a lot of people say, well, I'm on medication. And that's, hey, you know what? I'm taking medication. But medication, it's not the cure.
Medication is not the end all to be all. You have to also do lifestyle changes with that. And if you're still doing the same things that you were that got you into the predicament, such as not eating and not exercising, then you really aren't helping your situation. And the medication cannot do it all. It needs for you as the patient to make some lifestyle changes. If you're someone who's sedentary, who sits around, and you're not active, it's very difficult for medication just to be the answer to everything. If you have not changed your diet in any way, shape, or form, if you're still adding extra salt to foods, if you're eating prepackaged, a lot of frozen things that has salt added to it to keep it preserved while it is in the freezer, then you aren't really helping the situation. And I can't stress that enough. And a lot of patients will come back and say, this isn't working. Why is my pressure still high? And they're not understanding that there are other things that go.
Pig.
There are other things that go along with that.
Mhm.
Medication can't do everything.
So, would you say, what side of the fence are you on? Because different cultures, different environments. Some holistic doctors say you don't have to be on that medication forever. And then there's some doctors say, well, you're going to have to take this medication for the rest of your life. That's not with all, it's that with all type of medications. You're just going to have to be on it, I'm on blood pressure medication. So you're just going to be on that for the rest of your life.
What I like to talk with patients about, particularly initially, when we're having this conversation, when I've taken their blood pressure 2 or 3 weeks in a row and it's still elevated, and we're having the conversation about diet changes, which I've already asked them to make, and we've had the conversation about increasing exercise, even if it's just walking. I'm not saying doing anything strenuous. When we've had those conversations and now we're on the medication and we're seeing some reduction in the blood pressure, I like to give patients encouragement and I like to have them continue to make those changes. Now, I will tell you that for the most part, particularly in the African American community, if you aren't doing that combination of things, along with medication to get your blood pressure down, it is going to be very difficult to tell you that you don't need this medication and that you won't have to take it the rest of your life. But there is a slight percentage of the population who are able to lose weight. They're able to make the dietary changes and they're able to increase their exercise and their dosage of medication can be reduced. And I say all of this with caution because that should be done with your provider. It should not be done on your own because blood pressure medicine, if it is going to be changed or stopped, needs to be done in conjunction with a physician.
Wow. So you're saying, listeners, you cannot wake up tomorrow morning and say, I'm going to stop this medication just because it is Friday tomorrow. You decide not to have fried fish. And so you're doing your body a good service. You're not. We are talking to this evening Dr. Janice Seabrook, CEO of Community HealthNet Health Centers. Dr. Seabrook, it is so good talking to you. I mean, this is wealth right here. This is what I call empowerment for my listeners to understand. One of the things I want to go back and talk about is looking at those benefit packages, because like I shared with you, I saved over $1,200. It was over $1,200 that I saved. So with that, if they can go look at their benefit packages and see some of the things that they need or don't need, um, they can save money. So that's money that can go into the kitty for, you were talking about long-term care, short-term care,
Disability, yes.
disability.
Yes.
You know, flip that money over to something else that is needed. And I don't think a lot of times people are educated to this fact. And I'm not saying, please, so doctors, do not call me. Sometimes you just go into a doctor's office and you go out. You know, you're in there, how you doing, how you feeling, here's a prescription. But you're educating your people. Your staff is educating your people in reference to some of the things that they need to know. Ladies and gentlemen, there is 5 locations, and I need you to tell me the 5 locations. You do not need to walk down to the HealthNet centers. You need to run down there. You need to tell somebody to go there. I mean, we have to stop this madness. There are certain areas that are called the medication capital for pharmaceutical companies, because they make so much money in certain areas. And hate to say that Northwest Indiana is up there. Or is that true, or am I?
You're not exaggerating. What we have to do, and this is something that's been baked into the cake, so to speak, baked into the cake of healthcare. And we have to figure out a way to reform it. There has to be healthcare reform. There has to be changes as to the way we provide the services and the way that patients receive the care and the services. And you alluded to something a little bit earlier. You talked about coming into the doctor, you're in there, you get the scripts, and then you go. That's not the way that you should really be received as a patient. It has to be in any relationship. It's a two-sided relationship. It's bi-directional. It's not a one-sided relationship. And so the patient is the center of the medical home. And you're going to that person or that place of education and knowledge to gather the information that you need to better take care of yourself. If you're someone who on average goes to the doctor once a year, well, most people go at least twice a year, that is not enough time to be able to take care of yourself. So you have to be able to arm yourself with information to better be able to take care of yourself. One of the things that our health center has, we have electronic medical records. So no matter which one of our sites you're at, our providers are able to link into your medical record. Mm-hmm. But not only that, you can go and look at your own medical record because we have access, and it's called MyChart.
Yes.
And so if you're one of our patients, you're able to get a password and a login, and you can go to our website and log in and access your medical records so that you can better educate yourself about what's going on with you, and then have those intelligent conversations with your provider when you come to see your provider. I want to go back and give you the addresses.
Okay, because I want you to, because I've got seven people that has just hit me up to say, where's the places at, because they don't want to call in. I have a lot of listeners that do not like to call in because they think someone will recognize their voice.
No, that's understandable.
So please give us the addresses.
So I'll start out. We have 3 locations in Gary.
Okay.
Our main location is at 1021 West 5th Avenue, and that's right in front of the Gary Police Station and next door to the Gary Health Department. So it's huge. It's a large location. You can't miss it. We also have a location at 1015 Shelby Street in Miller, North Shelby Street in Miller, and that's our pediatrics only location. At our 1021 West 5th Avenue location, we have all health services. We have medical services, behavioral health services, and dental services at that location. Our third Gary location is located inside of Calumet High School. and that's 3900 Calhoun Street in Gary, Indiana. It's a full-service family medicine clinic that's open to the public as well as the students of the Calumet High School. Then we have a location in Hammond, and it is 5927 Columbia Avenue in Hammond, Indiana. And our last location is 6100 Broadway, and that's in Maryville. So we have 3 Gary locations, 1 Maryville location, and 1 Hammond location for our patients' convenience.
You know, it's so much information. Time is wrapping up. I'm going to get that information and I'm going to put it on our site so you guys can go to ourmoneymattersmovement.org and get this information. We're going to hook our links up together so they can come. Ladies and gentlemen, Dr. Seabrook, thank you so much. Will you come back again?
I will.
Register. Please tell people, I think I get like 2 minutes. Tell people to start registering to get their...
Yeah, call in, get an appointment, find out which one of our locations are convenient to you. I've spoken out in the community and just going various places and just having interactions with people, and I'll mention where I work and they're, oh, I'm a patient there. So I know the word is getting out and that the services that we're providing are being beneficial to a lot of people. I'd like to give one more phone number because this is the direct line to our insurance enrollment staff. 219-886-8980. 886-8980, and they will be directly connected to one of our health insurance enrollment staff.
Well, listeners, I'm going to put all this information on our site first thing tomorrow. Doctor, again, thank you for coming. Do come back, share that information. Listeners, share that information with one another. You know, our thing is to live your best life now. Talk to you. See you later.
You have been empowered for success with Rogina Smith. To contact Ms. Smith, email her at spositivemage@aol.com. Tune in next Thursday at 6:30 p.m. for our Money Matters Show with your host, Rogina Smith.